250 publications, and I know whenever I want something on this topic, his name is there. He's an expert on the costs and consequences of substance abuse, injuries, and violence. His cost estimates that he's prepared have been used by several U.S. government agencies and foreign governments as well. Federal, state, and local governments find his work very helpful because he's applied his cost estimates for more than 160 prevention, treatment, and harm reduction measures, including those that have been used here and implemented in California. He also recently estimated the costs of alcohol and substance abuse in California for each county. So you're going to hear more about that and some of his earlier research today. So we've had a lot of folks who work in public health and data analysis here in the room today who are very interested in his presentation, and I know I am. So please join me in welcoming Dr. Miller.
Thank you, Beth.
And he always has great ties.
And let's see, is this mic for the, okay. That's what I need to know. There's two mics here. Okay, so I'm going to talk to you today about the costs of underage drinking in California with new 2013 numbers. Also the costs of substance abuse in California, and we've done that by county, so I'll talk mostly about San Diego. I'm going to talk, before any of that, about why we care about costs. I'm going to talk some about the savings from prevention. If I've got time, I'm going to finish up by chatting a little bit about prescription opioid abuse, because it's all over us right now. I should tell you that I want to keep this informal, so interrupt me with questions as we go along. I will be making my PowerPoint available to IPS for distribution to anybody who wants it. The fact sheets that I mentioned, I'll send Rick the one, like Rick already has the San Diego fact sheet on the costs of alcohol and drug abuse, and I'll send him the new costs of underage drinking in California. So, with that. Oh, that works. So why do we study costs? We study costs because they're a single compact metric that takes things as diverse as somebody got killed, somebody broke a leg, somebody got drunk and had risky sex, and puts them all into one measure. And having one measure that fairly balances all those different outcomes is very useful in problem size and risk assessment, in priority setting and resource allocation, in performance comparison, program evaluation, and in advocacy and media communication. Well,
I read your PowerPoint, huh?
let's see. No, it's okay. I know how to do it. It's just this doesn't seem to. Ah, there we go.
Okay.
Okay, so let me show you some examples of each of these things. This shows you the involvement of alcohol and drugs and violence in the United States. You can see about half of it involves drugs and alcohol, and most of it is just alcohol. But if we look at youth crime, that picture changes. Now 70% involves substance abuse, and 40% of the kids with violence problems in terms of cost are alcohol and drug involved both. So what you're seeing is that youth violence is a multi-problem kid. And that helps to define the problem better. And I should tell you that the figures that I just showed you are based just on perpetrator substance use. But we know 40% of medically treated assault victims are alcohol positive themselves. And victimization is 7 to 10 times as likely during hours when someone is alcohol positive than during hours when they're sober. So that increases it. Here's a very brief example of priority setting. And this is just 3 school-based substance abuse prevention programs out of many that we've looked at. You can see that keeping it real costs a little bit more than the others, but it reduces alcohol consumption, and the other ones don't. And its benefit-cost ratio, almost as a result, is 3 times as high. That can give a real argument to a school board of why they should spend a little more on a program. And when I look at the benefits and costs of something, the benefits of prevention are reductions in the costs of substance abuse and the harms it causes. And that's important to understand because it's one of the reasons we're so concerned with about what are the costs of substance abuse so that we can evaluate what the savings are when we prevent it. This is a performance comparison on costs of underage drinking. And you can see that there's sort of this left side of the middle section of the country is where a lot of the problem is, and then down through the south in part. And here's an example of evaluation. The 21 minimum drinking age, you may have heard about the Diamond Initiative, which is the 100 college presidents who signed this petition saying we ought to debate rolling the minimum drinking age back to age 18. We know that the 21 minimum drinking age reduces the percentage of youth who drink and binge. It raises the age of initiation, which lowers the risk of alcoholism in adulthood. It reduces youth drunk driving deaths by 19%, reduces alcohol-involved youth suicides by 27%, and for some very strange reason, it confuses college presidents. I've got news for you, they're not confused, they're embarrassed. Those kids who are not legally drinking are committing suicide on their campus. They're passing out. They're getting raped. They're showing up drunk at class. They're getting expelled. If they can change the drinking age, they can say, it was legal, it's not my responsibility. They're not confused. The 21 minimum drinking age costs $230 a youth, and that cost is basically the cost of the youth no longer being allowed to drink when we pass those laws. It saves $670 a youth. That's what a benefit-cost ratio looks like. It saves $40 in medical spending alone. And the current cost of that is negligible. It's just a bit of enforcement. Communication. I want you to pretend that you're the governor of California. You've got 37 million residents here, 233,000 deaths in 2010. I'm going to try to convince you to continue my $2 million program to prevent alcohol-related injuries in the state. Governor, we did a thorough evaluation of our program. The results are highly significant statistically, sir. Our program reduced deaths, it reduced hospital admissions due to alcohol-related injury. Highly significant statistically, it reduced them both by 1%. Now, Governor, you promised your daughter that I could have 5 minutes. Look, our program prevented 50 deaths and 400 hospital admissions last year, sir. Governor, I know there's 200,000 deaths, but you can't throw me out. It's my house. Look, Governor, our $2 million program saved California taxpayers $70 million in medical payments and work loss last year, sir. That's $1,900 per California resident. You're going to double my program? Oh, your daughter's going to be so glad she went to the trouble to get that papaya this morning, sir. Those numbers are in proportion. And look at how different they feel. That's one of the reasons we use cost to communicate, and the press and the legislature always are interested in costs. So let me talk to you about how the industry profits from underage drinking as the public pays. Underage drinking is big business in California. In 2013, high school kids, 53% of them had tried alcohol, 18% of them before the age of 13. And 30% were current drinkers. 18% were drinking at least 5 at a session in the past month. And it's really big business. There's almost 1.2 million underage customers in California. Annual sales per kid who drank illegally, almost $2,800. And underage drinkers are great customers. If you look at the daily drinks per drinker, among illegal drinkers, it's 1.7. Among kids, they're drinking to get wasted. It's 5.1 daily drinks per drinker. 1.2 million customers. And when they drink, they really drink to get wasted. It's bad enough that among legal drinkers, half the alcohol is consumed by people who wind up above 0.08. Among kids, it's 80%. The alcohol industry, of course, denies that it markets to kids, but the signs are everywhere. Can you picture Beer Belly Bobby caught dead with an alcopop in his hand? Or Margarita Mary? Budweiser frogs, clever dogs. My favorite are the lizards. That lizard's big as a bar. These lizards are big as two-story bars. You know what? Those aren't lizards. Those are dinosaurs. Somebody tell me, what age loves dinosaurs? 5-year-olds. Barney. But lately the alcohol industry has realized that the lizards were captured by the beer industry, and that for the girls, the wine industry needed a nicer theme. So now we have Hello Kitty wine. You can buy it on Amazon. There are liquor stores that are selling it. I found an online review that I'm going to read you because it was just so striking that I thought it needed to be read. They might as well rename it Hello Creepy, because that's exactly how you'll feel purchasing Hello Kitty wine. From the moment you ask the sales clerk where to find it, right through to the cash register ring-up, where they encircle the neck of your bottle with a pendant suitable for a 6-year-old. A pleasant cherry berry scent, carbonation on my tongue, a bit of sweetness, a lingering floral aftertaste reminiscent of bubble bath. They don't market to kids. 12% of the alcohol in California is consumed by underage customers. And what do kids drink? Is it wine? Is it beer? Is it hard liquor? Tell me, what do kids drink? Beer? That's the answer. Anything they can get their hands on. And you know what? They drink a little more spirits than anything else because it's real easy to go to that liquor cabinet and drink that much out of every bottle. And if you want to drink some more, add some water into the bottles. And in the right households, find where Dad hid his bottle, and he was probably too drunk when he got done with it to know how much was left in it, so you can pretty much finish it. And if you're going to go tap somebody on the shoulder, you want enough to get wasted, and if they're the kind of person who's going to buy it for you, buy me one, I'll buy you one. 2 bottles of hard liquor if you got the money. There's a lot more drinks there. And then, of course, the alcopops. Almost half of the alcopops are consumed illegally by underage drinkers. We don't market to kids. We don't produce products for kids. By 12th grade, after 12th grade, by the time you're 19 years old, you're cutting out the alcopops. They're too sweet. We finally started asking kids where they got their alcohol. Most of them said they were given it. The second biggest thing was those shoulder taps. 8% of high school kids say they bought it. And in Indiana, they started looking by grade from the 6th grade. Really interesting data. You see in the 6th grade, they got it from their family, they stole it from their family, or another kid took it from home. By the time you get to the 9th grade, that's changed. There's still a lot of booze coming from home that's taken. But now we're getting given by people aged 21, and we're getting it from shoulder taps. And that keeps changing that way. Nationally, $21.6 billion worth of booze was consumed by underage customers in 2013. To give you an idea of how much that is, it's 1.5 times the worldwide sales of Starbucks. We get Starbucks on the airplane. We get Starbucks at our hotel. Every street corner has a Starbucks with a line. I go overseas, the lines are longer. And you know what? A cup of coffee at Starbucks costs more than a can of beer. Think of how much booze these kids are drinking. In California, underage sales are $3.3 billion a year. According to the Miller Brewing Company, up and down the distribution chain, there's $1.6 billion in profits in that. How much money can they spend to get the legislature to not spend money combating it? And a devastating tidal wave of alcohol-related harm results. More than 200 deaths last year in California, and that's down substantially. 4,500 kids injured in drunk driving crashes. 65,000 violent crimes, 100,000 property crimes, and that doesn't even mention the public order crimes. 125,000 kids having risky sex, over 3,000 teen pregnancies. And with 1.2 million kids drinking to get wasted, we put 5,200 kids in alcohol treatment in California last year. It's a huge unmet need. Underage drinking in California cost $7.25 billion in 2013. Almost all of that was due to breaking the law, violence, drunk driving crashes, and property crimes. And the other big piece was risky sex. To give you a quick idea of what's in those costs, about half of what's in there is pain, suffering, and lost quality of life of kids and their families, and of people injured in violent incidents and things like that. 31% of it is lost future work by those kids and loss of people who got injured. About 8% of it is medical costs, and 8% are other out-of-pocket costs, which I've labeled here other resource costs, mainly property damage and drunk driving crashes, police costs, adjudication and sanctioning costs in the criminal justice system. But what the psychologists tell me is that we don't know the difference between $7 billion and $720 million. Bill Gates knows the difference. Warren Buffett knows the difference. But you and I don't know the difference. Some of our state legislators might know the difference. But what can we do to make that more comprehensible? Give me some suggestions.
How many minutes would it take at $1,000 a minute to spend that much money away?
How much real estate can you buy?
How many baseball players it will hire?
Actually, I think you might get a whole team and still have money left. I heard another suggestion over here, did I hear? Young. Okay. So what you're all focusing on is yardsticks. And when I do a yardstick, I try to do a yardstick that not only makes it comprehensible, but that delivers some message about my issue. Nationally, underage drinking this in 2013 cost $60 billion. By comparison, the combined budgets of the U.S. Departments of Education and Justice were $70 billion. So all the money the feds spend on cops, all the money the feds spend on courts, all the money the feds spend on prisons, all the money the feds spend on high schools, on elementary schools, on colleges, the cost of underage drinking. The other thing that we can do is we can find a sensible exposure measure to divide by. And I say sensible because, again, something that helps you deliver your message. It's $6,000 per underage drinker. It's $1,750 per youth ages 14 to 20. My favorite is $3.30 per illegal drink in California. If we think of just the out-of-pocket costs, the average kid's drink carries a price tag of $1.40 just in medical spending and other out-of-pocket costs. Drinks at bar, drinks with buddies, drinks at parties, drinks stolen from mom's secret stash. $1.40 in costs. Heck, that drink only costs $1.50 at retail. There's only 75 cents in profit in that drink. What are we thinking? And incidentally, if I was working instead on an adult issue, I'd take and use that same slide, but now it's drinks in bars, drinks in cars, drinks with breakfast, bringing a different message out of the same numbers to a different audience. And the third thing we can do is show a performance comparison. This is California compared to some of the nearby states. And you can see you're not doing quite as well as Oregon, certainly not doing as well as Utah, and we all know why. They're really careful about drinking there. But doing better than the rest of the neighboring states and nearby states. And that tells you something about where all your hard work has gotten you, because it has gotten you down some. And the costs that I've been showing you are based on events caused by alcohol. For example, only 90% of alcohol-involved crashes are caused by alcohol. Because I might be a drunk driver who's sitting peaceably at a red light and a kid who's texting rear-ends me. 75% of alcohol-involved violence is caused by the alcohol. About half of property crime, a little more. And we assume about half of the risky sex that's alcohol involved, which is 1/8 of all risky sex. So I haven't heard anybody ask any questions. Maybe I just missed them, so I should see. Yeah.
I have a question. I got one. Are the prevention costs included in that total cost, or is that in addition to that total cost?
We don't have real good counts of the prevention costs. It's an excellent question. No, they're not in there because I don't have good track on the prevention costs, but they're not real large. They're an order of magnitude or two smaller, unfortunately. See, I saw, see that one? What?
So, the cost, there's been some complaints about the fact that the taxes on a drink are so low and they haven't been raised, yet the costs seem to be skyrocketing. So, what is the cost? What's the actual cost on a per drink? And I understand we're focused on youth here, but really, are the numbers significantly different for adults?
No, they're not. Actually, the average cost per drink is a little higher for adults than it is for kids, because a lot of those kids are not yet licensed drivers.
So I guess the question, what are we going to do about this? And how do we get the taxes increased on alcohol?
Remember how much money we just said that they're making in profits just on the kids? Now add to that all the profits they're making on the other 88% of the booze, and think of that as if they have to spend 1% of that budget to protect themselves with the legislatures. I actually think taxes are probably the most difficult way to approach the problem.
We have to have an action, sorry for continuing, but
Yeah.
I mean, getting information that we have nothing to do and have no action to take is really just frustration.
Yeah, no, I agree, and I think there are a lot of other actions that we can take. And we'll talk more about that when we get further down the presentation. Let's see, I saw a hand over there, and I've got one over there and then one here.
So I just want to clarify your numbers. Are those net costs or gross costs? Are you talking net costs after you take into account the profit?
Yeah, if I go back up here.
You're making it rather, because I'm a little confused about that.
Yeah, okay, this $1.40 is just the end. Actually, let's go to the one before it. This $3.30, those are just the costs of the harm caused. The $1.50 price of that drink is not in there. So the costs here are the price of the harm. Let's see, I know you had your hand up.
I wanted to address the influential factors that contribute to the youth finding this behavior so attractive. What are the most influential factors that are pointing this as a positive fun? What are they do? Is it the media? Is it the peers? Is it, internet, the phones? What? Because there's a lot of money going into advertising. And if you looked at the beach parties for spring break and saw the results of what was going on, as a parent, the first thing you think of is, there's no way I want my kid down there. If the kids saw it, it's going, oh man, me and my bud, we're heading down there.
Yeah.
So how do you get that paradigm shift?
I'm-
This is not the best outcome for you,
Right.
including what's happening to your liver.
Yeah, and the other thing is that all of those things, plus there's the fact that it's not just alcohol, it's also illicit drugs, it's prescription drugs, and prescription drugs are becoming increasingly the entry path because you can just grab them out of the medicine cabinet in many cases. There are a lot of kids now who are starting on prescription drugs without even starting with alcohol. And the other factor that's going on there is that brains are still developing. And while brains are still developing, we have this period where we're invincible. And these things are fun because they're intoxicating, they can be addictive. Our parents are doing them, how bad could they be? But I should also tell you, I'm an economist, not an interventionist, and so I'm not going to try to sort of say, here's the blueprint of what we should do. Yeah?
Are there any cultures that are doing better with their youth than we are? With regards to harm and cost, are there any cultures or any areas in the world that are doing much better than we are? Or are they really
I would say that the Mormons, where basically substance misuse or substance use is largely inappropriate, and where you can't buy wine or hard liquor except for at a store run by state employees. Remember that performance comparison slide at the United States? Almost all the states in green as the lowest, the state runs the alcohol stores. And state employees won't sell to underage drinkers. Their performance review does not have in it what were the profits of the store. It has in it, did you sell to people you shouldn't have sold to? It tells you what responsible beverage service can do. Yeah.
I just wanted to ask you to clarify what you included in quality of life costs.
Okay. What we do is we look at what people actually pay to reduce their chance of being killed and injured. Say, what do they pay for an airbag? What do they pay to, how much extra do you have to pay them to take a risky job? Things like that. And in that value is both what value we place on our quality of life and what we earn. And we'd separate those out. So, and economists are brave. There's like 100 and some studies in the literature that have done that now. And it's pretty well accepted. And when we go and we look at jury verdicts for things like violent acts or drunk driving, we can explain most of the variation in those verdicts for non-fatal injury just by looking at the impacts on, just by measures of what the quality of life impacts of the injuries were.
So is it mostly what you're talking about is when someone is injured or some other way harmed by an alcohol situation?
Yes, or when a kid dies because of alcohol. Because if a kid dies, they lose the whole lifetime of quality of life. you put a figure on that by looking at what people actually pay for small changes in their chances of being killed and injured. So if an airbag reduces your chance of being killed by 1 in 100,000, and $100,000, each spend $100 for an airbag, or spend $500 for an airbag, 500 times 100,000 is 5 million. And the value of a life is about the way we value our lives in the United States is about $5 million a life. And those numbers are used in all regulatory analyses by the federal government. So there's been a lot of study done of them. So let me move on to the costs of substance abuse in California. And our methods here are to sort of take the number of incidents of harm times the cost per incident. To get the number of incidents of harm, we start out by saying how many are there, but then we adjust it from statistics for what underreporting goes on, and again for those fractions that are attributable that I showed you before. And it's a blend in our estimates of local data and tailored national data. Local data include death counts, impaired driving data from the police, which we have to adjust for both underreporting of alcohol and underreporting of crashes, arrests and index crimes, child abuse and child protective services data, and hospital data on inpatient and emergency department discharges. Overall, we estimate that almost 28,000 deaths in California were attributable to substance abuse in 2010, and 2,400 of those were in San Diego County. 40,000 violent crimes in San Diego County, 15,000 crashes, and most of that results from alcohol. In all cases, 80% of the deaths from alcohol. Substance abuse cost $173 billion in California in 2010, of which $129 billion was alcohol, $44 billion was drugs. And deaths accounted for most of those costs, about 2/3 of those costs. If we look at the deaths, most of those deaths, the largest portion, are many years later because they're the deaths from the illnesses that come from substance abuse. The other half of them are acute injury of one sort or another. And what's in the $76 billion that isn't mortality? More than half of it is crime. It's drunk driving, it's violence, it's property crime. I always like to remind people that drunk driving is a violent crime. It's illegal, it maims, and it kills. The other half is hospital care for illness. And again, if we look at the cost by cost category, lost quality of life and pain and suffering are the biggest piece of this, though there's a substantial piece for lost work and medical costs. Give me a guess. What region of California has the worst alcohol problems?
Per capita?
Per capita. Central. Northern California, and then partially down through the agricultural part of the valley. And it's sort of the areas where they grow the marijuana. It's the rural areas. What do you think about drugs? And I should mention it's also the Bay Area a little bit. See it there? The Bay Area gets a bit more of the drugs, and it's basically the same areas on the alcohol and the drugs, though even more Northern California on the drugs. In San Diego County, the cost of substance abuse in 2010 was $14 billion. 3/4 of that is alcohol and 1/4 is drugs. Big business, and I did not try to find an appropriate yardstick for San Diego, but you should. The costs are about $4,600 per San Diego resident, $33.85 for alcohol, $11.95 for drugs. Governments pay about $1 billion of that substance abuse cost in San Diego. And it's about a quarter of all the costs other than the quality of life are paid by government. A mix of federal government, which is picking up the Medicare tab and part of the Medicaid tab, and then state and local government, which picks up the rest of Medicaid and all the adjudication and sanctioning and police and stuff like that. Yeah.
So for clarity's sake, the portion paid by government, which is really tax dollars, is relatively small. Most of it is quality of life, which is paid by the various victims, individuals.
By the individuals and their families, yes. But as I said, this is about a quarter of the total. So $4 billion of it is things other than quality of life, and that's still a big number. But you're right, there may be times if you're facing a hostile legislature where you're just going to leave out the quality of life. That's okay. Nobody said that just because I put it there, you have to use it. And we always show it explicitly where it is, so you can leave it out if you want to. The other thing is if you're worried that some legislator might say to you, well, how do you know life's worth $5 million? Let the bearer of the numbers be a survivor or somebody who lost a loved one to drugs or alcohol. Because when a legislator is sitting there talking to somebody who lost a loved one, if they are not empathic enough that they would never think to say, how could your husband have been worth that much? They never could have gotten elected. So you've got a standard bearer for that data if you need it, who's not going to get questioned in testimony. And I actually think that when government leaves out quality of life, because sometimes they do, Centers for Disease Control leaves it out. I think they do a disservice to the advocates of the world and to the victims of the world. Because they're the ones who lost that quality of life. So.
Was that you?
Are there any more questions on this one before I move into prevention? Yeah.
I just wonder, what opportunity, what strategies do the alcohol economists use to make sure that this information reaches public officials? I mean, the alcohol industry has lobbyists, do you?
What I do is I go around and tell folks like you and put it up on the web and hope folks like you find it and try to help you find it. And I do have a little bit of money to give technical assistance occasionally to answer questions and stuff. But my job is to produce the numbers and get them in the hands of people who can use them effectively. Because I'm one person and it takes an army.
I wasn't trying to put you on the spot.
Oh, no, I know. But it's a good question. Let's see, I've got a question here and then a question there. Yeah.
Relative to the quality of life, your statistics deal in terms of a specific period of time, is that correct?
Yes.
The quality of life to a young person who is injured at the age of 16 because of alcohol, and lives to be 80, that quality of life each year is greatly diminished by extensive injury that impacts in multiple ways. So
Yeah.
to put a dollar figure on it, it is a fleeting number,
Mhm.
ever changing
No.
because of the nature of the possibilities of that injury.
Well, it's an excellent question, and it causes me to clarify something. The way we do things is if you get in a drunk driving crash in 2013, we look at the lifetime of results. We look at the medical costs across the rest of your lifetime, the quality of life losses, the work losses. If you get killed in 2013, so our numbers are essentially based on the incidents that occurred in that year. Let's see, over there.
Well, you're basically saying you're giving the information to this group, so this group can then do the educating, the lobbying. However, there's a huge number of people in this room that work for politicians that are being paid by government, and there seems to be a complete disconnect between how do we educate our bosses, who are the politicians, who are the elected officials. I'm concerned. I'm concerned that this group doesn't do the lobbying because lobbying is a bad term. It's only a bad term in prevention.
Well, I think we do education more than lobbying. And education is something we're allowed to do. Yeah.
No, I tried to comment, it's just education is to discover the truth. The truth is what it is, it has no agenda, it's the facts.
That's right. Yeah.
So, quick question, a lot of the dams that you've been showing has been, national, state, county, but most of the work that's done in this room is municipalities, with local change, local policies and such, not really. So, how do we extract this information on the local level? I know it's difficult, but, is there ways we can go to use that for local policy?
The further down you try to drill, the harder it is to get reliable information on counts. Now, we do have this same data for the county for 50 medium-sized cities in California. Paul Grunwald at Pyre has those data. But in general, I think county is about as far as you can reliably drill down with costs, because you start getting sparse data. Like it doesn't work to have one drunk driving crash this year and none the year before and two the year after, unless you've got 10 years of data to average that are reliable to even know what the incidence is when you start getting to small communities. Yeah.
I know you said taxes will be difficult raising that, but how much does advertisement play in the profits? And any of your research show what is happening in maybe other countries where that advertisement isn't there for alcohol?
Media stuff is not my area. I know that you've done a lot of work in that area and that you've probably talked with Cami a lot, and they'd be better people to ask that question of. I saw a hand over here.
To know if you could go more into the link between property crime and alcohol, and so like what that looks like. I couldn't remember what the pie chart, what percentage it was. But
Yeah.
like what does that look like?
It's about 54% of all property crime and an even higher percentage of public order crimes. Like most public order crimes are drunken, disorderly, loitering, stuff like that. Almost all of that involves drugs and alcohol. A lot of the youth prostitution involves drug and alcohol as well.
So would that include something like someone getting drunk and then going robbing? Is it that kind of?
Yes, it's robbery, burglary, it's burglary, motor vehicle theft, and larceny. And the larceny is a little bit less alcohol involved, but an awful lot of burglary and motor vehicle theft are alcohol and drug involved. And then there's another group of them that get money to buy drugs. Because drugs aren't cheap. You can spend $25 to $40 a pill for prescription drugs on the street. Yeah.
Have you compared our statistics to a country that does allow 18 or younger age and see the differences? Are they worse? Are they a little better? If they are, what are they teaching their youth how to handle alcohol responsibility at the age of 18? Because I know that time their brains are not fully developed even at age 18. I think 23
Yeah.
is when their brain is fully developed. So are they doing any better than us?
They're doing worse. New Zealand rolled back its minimum drinking age, and deaths and injuries shot up. And they would have repealed it except for the alcohol industry went in and spent a lot of money and kept it there. Australia has bad problems. France has huge drunk driving problems. France has this reputation of they drink responsibly. France, drunk driving is just rampant.
They don't even drive that much per capita as we do.
No, they don't drive as much per capita, but the portion of their crashes, their drunk driving, are just terrible there. We've made a fair amount of progress in drunk driving in this country. The French have not. But it's always, there are always people with a story, but stories are not data. Yeah.
Concern that I have, the statistics you present are based on incidents, whether it's a medical one or other kind of incidents. But what about the young people that are doing the drinking that are not involved in incidents that are reported for whatever reason or for whatever value? That's a concern, because these too are young people that are consuming alcohol, consuming drugs, and yet they're under the radar of statistics.
Well, remember, I adjust for underreporting.
I'm sorry?
I adjust for underreporting.
I know that.
So I take account of what portion gets reported.
Yeah, I know that you can only go with data that's reported.
No, I don't only go with data that's reported. I adjust for underreporting in statistics. We have studies that we use to adjust for underreporting. So very quickly, we can think of intervention as a three-legged stool. We prevent what we can, we reduce the harm of what we didn't prevent, and we treat what's left. And there's universal prevention, which tends to be environmental. There's selective prevention, where we educate those at risk. And there's indicated or behavioral prevention for those who already have a problem. I'm going to talk some about environmental prevention today and the savings from it. Environmental prevention largely starts by building support and changing norms, building public support. Once you've done that, you can implement policies and laws. And a policy doesn't need to be public. It can be the rules of the household. It can be the rules of the workplace. And also, because you've now got that public support and you've changed norms, you can enforce those policies. And then there's a subset of environmental prevention that's passive. It doesn't take doing anything with rules other than putting it in place. When you put safe end caps on guardrails, so if you hit the end of the guardrail, you don't die and your car gets steered back onto the road, you save lives of drunk drivers. But it's totally passive. Nobody needs to do anything once it's there other than maintain it when it gets hit. Yeah?
Could you restate what you said about policies or changing the norms? Could you say that again for me?
Sure. When you've got the support and you've changed norms, that makes it much easier to pass laws and to implement policies around an issue that help to prevent.
And policies aren't just governmental, they're policies that exist in little small nucleuses.
That's right. A policy can be no smoking in the house. A policy can be no alcohol to be consumed on the premises. A policy can be no guns in this Starbucks. A policy can be anyone who arrives intoxicated at this company is fired. A policy can be we test for drugs and alcohol, and if we find you have a problem, we will get you into treatment. And if that treatment is successful, you keep your job, but we will not tolerate continued problems in this workplace. When we look at benefit-cost ratios for environmental controls, they're pretty good. A 20% alcohol tax is about 8. A 30% alcohol tax is about 5. Very high for enforcing laws against serving intoxicated patrons, because it's really cheap to just go enforce. Much lower for mandatory server training, because servers keep turning over, so you have to keep training new people. And that's expensive. It's expensive for the employers. Nice benefit-cost ratio for reducing alcohol outlet density, and that benefit-cost ratio takes account of the inconvenience for the people who have to drive further to get their alcohol. That they might run out of alcohol on a Sunday sales ban on a Sunday, and instead of putting bourbon in the cupcakes, they might have to put rum in the cupcakes. That's all in that cost. That's the only reason that benefit cost ratio isn't higher. You asked about alcohol advertising, and that's the benefit cost ratio there for an advertising ban.
Can we go back?
One, sure,
That 55 number?
yeah.
I mean, that's the elephant in the room here, right? I mean, what can be done there?
The reason that that's so beneficial is because it's so cheap to go enforce. It has about the same benefits as any of the others. But enforcing is really cheap once you've got the law passed. And when I look at some of these others, I'm taking account of, like with the alcohol tax, that some people couldn't afford to drink anymore, that they wanted. That's part of the cost. If you look just from government's perspective, these would be higher on things that are in that category. Yeah.
I noticed that the reducing alcohol outlet density was, by 10% was an 8.
Yeah.
8 times. How do you figure how much it's going to cost to reduce alcohol outlet density by 10%?
Okay, the main thing that's in the cost of reducing alcohol outlet density, again, is the drinks that didn't get consumed. And we actually value those drinks at half their retail price, which means that we take account, in some ways that conveniently is the total profit up and down the chain of the alcohol industry. The reason we don't value it at the total price is because you're going to then spend that money on something else which has some value to you. You're going to go to the movies instead of going to the bar.
So an opportunity.
Yeah, so it's an opportunity cost.
The cost would be mainly the burden to the alcohol industry in that particular matter.
Well, and to the drinkers, because the drinkers had to do something else other than drink, or they had to drive farther to buy their booze. Yeah.
Well, it's ironic that it seems that if there's 5, 8 times the value of all, even at the best, the other ones that we need to be looking at ways to make that more efficient or make that more possible.
Right. Well, the good server enforcement is testers. It's just over 21 kids going in and trying to buy. It's people who are drunk going in and behaving drunk going in and trying to buy. That's the kind of enforcement we're talking about here.
But we know through a study done at City and State that servers serve about 8 drinks an hour, 8 drinks in under 50 minutes over 90% of the time. So we know there's a chronic problem with over-service, and yet it is the thing that is the most difficult to enforce, and even though it's giving this kind of value.
Right. It's not difficult to enforce in communities like some places in Georgia where they have gone and said, we're going to spend the money to have people pose as drinkers, problem drinkers, and see if they get served. And it works. And the bars rapidly realize that there's enough testers around that they better clean their act up, at least for people they don't know.
So just to be clear, that's $8 for every $1 spent? Is that what
That's right. All of these are like $8 for every dollar spent. Rick?
Just to talk a little bit more about the enforcing the intoxicated patrons. A lot of times with police departments, it's a burden to get a violation. But like you say, there's other ways of doing it. Just doing an observation, in a short period of time, if then the letter from the police chief goes to an establishment, it can almost have the same effect that, hey, we're watching. So you can sort of reduce the burden, if you will, of police time to actually get one citation by doing much streamlined.
Yeah. And if we look at the Sinar Amendment and what we did with tobacco and underage kids buying tobacco, we did it nationwide. And we made a real dent in how much tobacco kids could buy. It worked.
And how many people use tobacco going forward?
That's right. The other one that I'm very fond of is the graduated licensing or provisional licensing with the midnight driving curfew in it, because we've never evaluated what that midnight driving curfew does to drinking, to drugging, to risky sex, to violence. We've just evaluated what it did to drunk driving and to driving crashes. But you tell me a kid can't drive after midnight, that's got to have some other positive effects. And the communities that care stuff, where they go out and they work with a coalition, and the coalitions decide which problems they want to work on and choose evidence-based programs, has a very high benefit-cost ratio, about 15-to-1. And they've published that. Yeah.
So for the enforcing the talks of the patrons, the restaurants, I just saw a study on the Huffington Post that they instituted. They don't ban tipping, but they increased their wages and gave them benefits so that they weren't dependent on the tips, and that they found that their alcohol, the amount of alcohol was reduced. They realized the savings from all that. So I was wondering if your study looked at that at all. I know that's kind of more indirect, but
Yeah, it's a great question. I have not seen that. I think the place to look at that would be to compare the US with Australia, where they don't tip, and to see what the difference is in serving of intoxicated patrons in restaurants in particular. I think it's a great question.
Could I clarify that? Did you say without having to tip, they sold more or less?
they sold less alcohol. Well, what it showed was that basically because tipping is an incentive for servers to slide people more alcohol, and so they do it for their economic reasons because they're dependent on tips. And the restaurant industry is like that, obviously, but if the restaurant industry increased their wages because didn't tip at all, the customer service was improved, that alcohol, the supplies from the restaurant, that they realized savings because they found that when you tip at bars or restaurants, that leads to more, the servers basically over-serving.
Yeah. Okay, so we're getting close to the time we have to end, so let's take the last quickly. There are a number of workplace programs out there that are sort of training for workers. Some of them are like group training for restaurant workers or for other workers or for military. Some of them are programs that integrate substance abuse into health and wellness programs, which can be very effective. And one thing you learn as you look into substance abuse prevention programs is that no one substance abuse intervention reduces most problems more than 10 to 15%. So we need a package of complementary interventions. And that's particularly true when we get to drunk driving. And when we think about drunk driving, there's all sorts of things. There's hardcore drunk drivers, there's under 21 drinkers, there's motorcyclists, there's people who went to a breakfast like this that wasn't as responsible and had one or two too many Bloody Marys. And we can target different interventions to all those people. Sobriety checkpoints, zero tolerance for youth. The best thing for the recidivists appears to be ignition interlocks mandated on cars. More states are moving into that. And we can even do things like just child seat laws and motorcycle helmet laws and primary belt laws. And those protect both people who got hit by drunk drivers and sometimes protect drunk drivers. The reason motorcycle helmet is so low there, incidentally, is because I do take account of the loss of freedom and the discomfort and inconvenience of a motorcycle helmet. That's all counted in that benefit cost ratio. Yeah.
Have you been measuring in the Uber factor the amount of opportunities, the reduction in drunk driving because of Uber and Lyft
No, I haven't. But what we do know is that a lot of the older programs that were, quote, rideshare program, that were, we'll call taxi for you programs, actually were put together by the alcohol industry and increased alcohol consumption in some cases. People got drunker and maybe they then got home and were violent instead of. The other thing I worry about, even with .08 to some extent, is that to the extent that it shifts drinking from the bars to the home, maybe it shifts us from barroom brawls to domestic violence. We don't know. We've never looked. We should look. So in summary, alcohol and other drug abuse in California cost $173 billion in 2010. Underage drinking was $7 billion of that. The costs of substance abuse are useful in risk assessment, resource allocation, evaluation, and advocacy. Costs can sell your programs. They fairly weigh the components of the substance abuse problem. And when you communicate them, show a yardstick, divide by an exposure measure, compare performance, and put a face with the numbers. Get somebody to tell their story, because sometimes that's what really sticks with people and makes a difference. I'm going to real quick just mention the prescription opioid problem, because it was shooting through the roof here, and we tried to intervene a couple years ago, and now we've got heroin as a substitute shooting through the roof with it. And you may be saying, well, it's not that bad in California. This is 2010, and you were not in the top ranks of prescription pain reliever sales. This is 2013 self-report on non-medical use. And California, it's getting here, folks. It looks like it may be here. And prescription opioids have passed marijuana as the drug of choice, first in Tennessee and now in a number of other states. Because despite the efforts of the medical marijuana industry, your health insurance won't pay for your grass yet, but it sure will pay for those prescription opioids, those prescription ADHD stimulants that the girls seem to love. And more teens say they can get their hands on prescription drugs and marijuana within an hour, because you can take them out of the medicine cabinet. Easy access has made those things entry drugs, often not preceded by alcohol. We're hearing of Skittles parties. A Skittles party is, we go to the medicine cabinet, we see whatever looks psychoactive, we bring it to the party, we mix it all together in a bowl, you take a spoonful, you wash them down with a glass of booze maybe. By the time they get you to the emergency department, nobody has any idea what you overdosed on. They don't have any idea how to treat it. One of the primary interventions is lock the stuff up. Take a list to the pharmacist of everything that could be lethal and everything in the medicine cabinets that prescribed to anybody, and even acetaminophen and other non-prescription drugs, and say, if you took the whole bottles in combination, what could be lethal? That's what you need to lock up. And if anybody is a multi-problem kid in the family or is depressed, do the same things, because a lot of suicides are, I emptied the medicine cabinet. You want them to live. Take back is a primary federal strategy now. Don't keep the old drugs. Though our pharmacies don't want to take it back. They switched to try to move it to pharmacies. The pharmacies are saying, hey, that's expensive. Why should we? You've recently had a major court ruling that the couple counties in California that had passed laws saying that the pharmaceutical industry had to pay for take-back of unused pharmaceuticals. The Supreme Court just refused to review an Eighth Circuit Court ruling that that was legal. So in California, there is no ability, on at least the same arguments, to challenge in court those laws at this point. The U.S. Supreme Court has said they go into effect. I run SAMHSA's Prescription of Drug Abuse in the Workplace Technical Assistance Center. We put out a weekly update on prescription drug abuse. If you want to subscribe, it's free. Just browse to paw.dsgonline.com, and just put in your email address. If you don't like it, it's equally easy to unsubscribe. I recommend it. It's very readable, and I say it's very readable because I helped write it. And it's my job to go over everything and say, oh, that's too scientific, and make it easier. We've got more than 30 fact sheets up on the West Virginia University website. If you just Google SAMHSA fact sheets WVU, it'll pop right up. And a lot of those are around things like, don't get your prescription drugs stolen. If you're having a party, when you lock up your valuables, if you're showing your house because you're selling it, don't forget that the prescription drugs are one of your valuables. Because some of those pills are worth $30 on the street. A pill. You've got a 30-day supply? No wonder they're stolen. We offer free fact sheet masters with your organization's name and address added. If you just email me, I'm miller@pyre.org. We can put on your logo, put on your address, and send back PDFs of any of the fact sheets that we have up there. And with that, I think I better get off the stage. I thank you all.